Hi there, my name is Taylor Carls, and this is my final presentation for COM 320. Today I'm going to be talking to you about teamwork in healthcare. So a little bit of an overview is what is teamwork, why I chose teamwork as my topic. I'm going to be discussing my research articles for this given presentation. I will then talk about my healthcare leader interview with Mackenzie Welcher, and then I'm going to wrap everything up with you. So I know we all have a general understanding of what teamwork is, but this quote from Stanhope and Lancaster really gives a good definition of the word and how it relates to healthcare. So teamwork refers to the ability to function effectively with nursing and interprofessional teams and to foster open communication, mutual respect, and shared decision making to provide quality client care. So, some of you may be wondering why I chose to do my presentation on teamwork. Well, I chose to do it because teamwork is crucial to many aspects of life, especially in healthcare. So, I started to wonder why we should use teamwork when there are situations that we are capable of doing things on our own, which then led me to research what are the benefits of teamwork. Overall, I hope to learn how to better build teams and how to effectively use teamwork in the healthcare field. For my research articles, I actually found 4 that related to my topic quite well. Article 1 was Building Positive Relationships in Healthcare, Evaluation of the Teams of Interprofessional Staff, also known as TIPS, Interprofessional Education Program. So, this was founded by a nurse and physician duo who were trying to get a better working relationship between the two groups. They found that teamwork and collaboration leads to improved patient care, reduced healthcare costs, and improved job satisfaction. They also talked about how the participants said that the biggest gains from their involvement in the program were an increased awareness of interprofessional practice and education, the roles and responsibilities of their team members, effective team functioning, and limitations and barriers of their team members and what they face on a day-to-day basis. So overall, this article really emphasized that it leads to heightened staff satisfaction, and this was shown by the statistics of the mean outcome of the participants that they began at a 3.97 and it increased to a 4.53, showing a really great and heightened staff satisfaction. So, Article 2 is Team Building Across Healthcare Professions, the Elderly Project. This was measured by the participants' communication and knowledge by giving them an IQ test on teamwork and then following it with a survey. This was done prior to training and then after the training, and their IQs were increased from a score of 63% to 68%, which showed a good increase. So Article 3 is a systematic review of team building interventions in non-acute healthcare settings. They talked about how there were type of activities that led to improved teamwork. Some examples included ongoing learning activities that were embedded in periodic team meetings or available online, formal workshops, role plays, interactive discussions, and simulation. There were also pre- and post-training activities, and pre-training included things such as talking about goals for the day, discussing leadership, and reviewing patient care needs. As for post-training, they debriefed of what went well and what needed improvements. So they also talked about how teamwork improved patient care. And some examples of this included reduced falls, reduced seclusion rates, reduced stays, and increased patient satisfaction, which is super important in healthcare. So Article 4 is using teams to improve outcomes and performances, and they speak about how having one leader is beneficial. One quote that really went to show is that one leader is beneficial is the leader is responsible for leading and facilitating the work of the team, managing and allocating resources, and reviewing the team's performances through situation monitoring, periodic and critical event debriefings, and leading after action reviews. So one really important thing that I thought of was we all make mistakes, and imagine what it would be like if we made a mistake and it was never caught. In most jobs, it's okay to make those mistakes, but in healthcare, it could mean life or death if they were not caught and corrected. So, by having a leader to oversee those actions and to help us when we make mistakes, it makes a critical choice in healthcare. So, I chose to interview Mackenzie Welcher. She is a BSN RN at Fremont Health Medical Center. She has worked there a little over a year now on a medical surgical floor. She agreed in all aspects that teamwork is essential for healthcare work. It benefits patients, and overall, one thing that keeps her going from day to day is seeing that her patients are happy and getting better. She also agreed that it heightens staff satisfaction, and one thing that I didn't think of is that it prevents energy and burnout on a day-to-day basis, and she said that is super important in her line of work. So, one quote that she mentioned was having one specified leader of the team is always valuable, and she mentioned that she likes to know who the charge nurse is at the beginning of the day and which doctor is in charge of which patient, so in case she ever needs to turn to anyone for help, she knows who to turn to. So, conclusion is that teamwork is crucial in many aspects of life, and as all of us are going to be healthcare employees, I encourage you to take away how beneficial teamwork can be when it is used correctly. So, some benefits of teamwork is better patient outcomes, heightened staff satisfaction, reduced healthcare costs. One quote that I found in one of my articles is, in the case of teams, 1 plus 1 does not equal 2. Teams are greater than the sum of their parts. They allow organizations to exponentially multiply resources and outcomes and innovate in ways that are generally impossible when people work in isolation. I encourage each of you to really read this quote and understand what the authors are trying to get across. Teamwork can be so useful when it is used correctly. Here are my references for my presentation. And I just wanted to take a minute and thank you all for watching my presentation, and I hope that you all gain some knowledge and look into using teamwork in your future. Thank you.